Hello, and welcome to a leadership book review on Results That Last. My name is Eddie Winslow, and this is impartial fulfillment for the requirements of leadership in complex healthcare systems. So we'll begin with the author. Quint Studer spent 10 years working with special needs children prior to entering the healthcare industry in 1984, where he became a community relations representative. Afterwards, he served as department director, vice president, senior vice president of a number of organizations across the U.S., including Holy Cross in Chicago. Afterwards, he became president of Baptist Hospital in Pensacola, Florida. These experiences have helped him build a platform for creating tools and techniques for improving system processes and organizational performance, and most importantly, patient care. Then in 2000, Quint Studer formed the Studer Group to assist facilities in implementing evidence-based leadership systems that help organizations attain and sustain outstanding results. Today, the Studer Group is composed of over 700 hospitals and organizations across the United States and acts as a source for where best practices are discovered and also a laboratory for where they are tested. Today, those results are published in peer-reviewed journals. Quint Studer has authored a total of 6 books, 2 of which have become bestsellers, and he currently remains in the field, creating tools and techniques to improve organizational processes. Results That Last is intended for the non-healthcare leader to utilize many of the tools developed by Quint Studer in the healthcare industry and to perform an overall culture change throughout the organization. This culture change is brought about by developing the current and future leadership of the organization by utilizing simple and easy-to-use tools and techniques which align behaviors with the mission and goals of the organization to improve the leadership, customer relations, and organizational outcomes. These tools and techniques taught in this text include standardization of behaviors for leaders and employees by aligning processes to meet the organizational goals, increasing morale and accountability by developing an evaluation system for leaders to hold others accountable. Some of the strengths include a common-sense approach to solving problems commonly seen in healthcare industries and an easy-to-read format. This approach begins by evaluating and developing the leadership of the organization and then setting the expectations for the leadership team. The low-performing leaders will become more apparent and should be addressed by encouraging them to meet those expectations or to seek new opportunities. Some of the techniques for setting the bar for leadership include committing to excellence, building a culture around service to the customer and employee satisfaction, measuring outcomes to show successes, then recognizing and rewarding those successes, no matter how small they may be. An example Quint Studer uses to illustrate this was related to an experience at a hospital that had very low satisfaction scores. After implementing some of these tools and techniques, the hospital moved to the 40th percentile. But this is very far from where the leadership actually wanted to be, but it was much better than it had been so far, so the facility had a celebration around the successes that they had had. Some of these other specific tools included in Results That Last are managing up your employees by sharing the good work of your subordinates to your superiors. This allows the senior leadership to report back to the subordinate that they've heard what a good job they've been doing. This then reinforces the behavior of the employee. It also includes managing up your coworkers when handing off a patient or a client or a customer. An example of how this may look is when a nurse is transferring a patient to another department. At that point, you can introduce the patient to the nurse and say, "This is the nurse I was telling you about. She will take fantastic care of you because she's one of our best nurses here." This book is filled with common problems encountered in healthcare organization, and Quint Studer uses real-world examples from his own experience to illustrate how these problems can be addressed. Some of the weaknesses for Results That Last may be that it focuses on a target audience intended for non-healthcare leaders, but is based on learnings from the healthcare leadership techniques and in a healthcare environment. Quint Studer experiences are largely from healthcare settings, and while many of these techniques may be useful for a non-healthcare environment, many of his examples are based in the healthcare setting. For example, Quint Studer describes the importance of knowing what your employees need to perform their job. He describes it as knowing what their what is. He relates a story about how he noticed nurses in a surgical ICU using hot water from a coffee maker to have an adequate amount of hot water for bathing patients. After identifying this need, He had a plant operations team create a system to provide the nurses with an adequate amount of hot water for both patients and for the nurses' coffee. While this technique of knowing your employee needs and removing barriers is useful in any work setting, his example is from his experiences as an administrator from a hospital. Additionally, the focus group for this book seems to be for higher level leaders. Some of the techniques for design and implementation may not be useful for frontline managers. For example, entire chapters are dedicated to standardizing leadership behaviors and developing new leaders. Additionally, Quint Studer describes how the reader should develop an evaluation tool for leaders that report to this reader. Overall, Quint Studer achieved the results he was seeking in Results at Last. This book was developed in an easy-to-read format which is targeted for leaders with managers as subordinates, although he does offer tools which frontline managers can use. While many of the examples Quint Studer uses are based in a healthcare setting, as this is his background, many of the tools he suggests would be easy to implement in a non-healthcare setting. A few examples of techniques which Quint Studer suggests could be easy to implement in a non-healthcare setting include the use of peer interviewing techniques and building accountability into the organization. Again, he relates his experiences as a hospital administrator with the origins of the practice of peer interviewing from physicians interviewing peers in group practices. However, the use of peer interviewing could be applied in any setting which hires individuals which must work together. For building accountability, Quint Studer suggests leaders encourage subordinates to take ownership of the goals and values of the organization by empowering them with the information they would need to take ownership and encouraging innovation within the organization by rewarding individuals which bring new ideas, no matter how small or cumbersome these ideas may be. Quint Studer even provides simple and specific techniques to reward individuals, such as how to write thank you notes. Thank you for listening to this presentation. If you have any questions, please feel free to post them on the discussion board and I'll be happy to respond.